Thank you for joining me today. In this video, you will learn more about dementia. Dementia is a major neurocognitive disorder. It impairs the person's ability, and it is chronic and progressive. It is not a delirium. It affects the attention. It affects executive function. It affects learning and memory. It affects language. It affects perception and motor. It affects social cognition. It is adequate significant cognitive decline that impairs person's ability to do the ADLs independently. And the epidemic of dementia include a primary effects that it primary affects older adults. Prevalence increases with age, doubles every 5 years after 65. Most common causes is Alzheimer's disease, and that is 60 to 80% of it affects 60 to 80% of people diagnosed with Alzheimer's disease. So Alzheimer is the most common disease that dementia affects people with Alzheimer. It also affects, there is also Lewy Body dementia, Frontotemporal dementia, Vascular multi-infactor causes such as stroke can cause dementia. Other causes include Parkinson's disease dementia, HIV, or prior diseases like stroke, tumor in the brain, or HIV can also lead to dementia because it destroys the brain cells. Reversible causes. There is a reversible causes of dementia, which is if the patient is B2, vitamin 12 deficiency, if they have hypothyroidism, normal pressure, hydrocephalus, depression, pseudo dementia. So if this condition is if you treat the vitamin B12 deficiency, if you treat the hypothyroidism, if you treat the normal pressure, hydrocephalus, and the depression, dementia can improve, because what causing the confusion is this diseases or conditions or deficit. If you treat that, the dementia can improve. So it depending on the reversible causes that causing the dementia. So the clinical features of a dementia include early memory impairment, especially recently, difficulty with complex tasks, were founding difficulties, displacement object, so they forget when it's early, the patient will forget where they place their object. It's hard for them to speak or finding words. It's difficult to do complex tasks. It impairs their memory. And then when it progresses to middle, it impairs their judgment, disorganization to time and place, behavior changes like agitation and apathy. Late dementia is a severe cognitive decline, loss of recognition, total dependency, and more impairment. For the severe cognition decline, I have seen patients who, when they saw somebody they don't know who they are. Let's say they see their daughter and they say, oh, this is my mother. They know this person is one of their family member, but they cannot tell the age different. They think she is their mother, but this lady is their daughter. They will see their son and they say, this is my father. They will see their grandchildren. They will say, this is my brother. So they forget the time, they forget their age, they forget the people around them. They remember the faces that they saw this face before, but they cannot know how they relate to them. So behavior and psychological symptoms of dementia include agitation, psychosis like delusion and hallucination, depression and anxiety. So dementia causes those. Dementia causes agitation, anxiety, psychosis, delusion, depression, sleep disturbance. These symptoms can lead to hospitalization. It can lead to caregivers burnout. It is irreversible. Survival is very often years. So onset of dementia is a gradual and it's progressive. Perceive early and normal. So you want to orientate, you want to keep the patient safe. How you diagnose dementia? So dementia is significant decline in one domain or more. Interference with independent, no delirium, no explanation, other diseases. How are you going to evaluate the dementia? You will evaluate the history of the confusion or the causes. You want to evaluate you want to collect the samples. You want to assess the functional decline. Some of the labs that you want to assess is vitamin B12, thyroid, CMP, infection. You want to also do imaging like CT or MRI to rule out stroke or tumor. What are the treatment of a dementia? Dementia, there is no cure for dementia, but the goal is to slow down the progression of dementia, to preserve the function, to manage the behavior, to support the caregivers. So there is no cure for dementia, but you want to slow down the progression of the disease and you want to preserve the function. you want to manage the behavior, and you want to support the caregivers and the family. Non-pharmacological treatment include structural routines, cognitive stimulation, environmental safety and prevention of falls and wandering, reorientation strategy. You want to educate the family and caregivers to supportive programs. Long-term plan, you want to educate them to plan long-term because it will take long-term to take care of this patient. Most important, foundation of a care. So the cognitive symptom is you want to treat the behavior, and cognitive symptoms treatment will be cholinergic inhibitors like the donepezil, that's Parkinson medication, refersagine, galantamine, and their mechanism of action is they increase memory pathways. They improve the memory pathways by increasing acetylcholine. Indication is a mild to moderate Alzheimer's disease. Symptomatic only. Other treatment will be memantine. Memantine is dementia medication. It lowers glutamate exotoxicity. Glutamate exotoxicity. It lowers that. And the indication of using memantine is moderate to severe dementia. It can be taken alone or with cholinesterase inhibitors. Behavior symptoms, no pharmacology treatment for the behavior treatment. If it's severe, you want to use antipsychiatric medication for short term only. If there is a depression and anxiety, you want to use SSRIs. And the risk of that will be, it will increase the mortality in older dementia patients. It increases the risk of a stroke. Treatment underlying causes. You want to control the hypertension. You want to treat the diabetic that can cause vascular dementia. You want to treat vitamin B12 deficiency, hypothyroidism. You want to address the depression. Clinical management include maintaining independence as long as possible, prevent complications such as fall, malnutrition, infection, advanced care planning. Prognosis, progressive decline and disability. It leads to disability. Common complications include aspiration pneumonia, Immobility complication is significant, and significant caregiver burden. Those are the common complications of dementia. Dementia is a memory decline and the ADL impairment. Dementia is the most common patient with Alzheimer's disease. You want to rule out reversible if there is a reversible cause first, and you want to treat these reversible causes first, like the vitamin B12, like hypothyroidism, depression, underlying diseases that can be reversible. You want to treat those first. Thank you for joining me today. I would love to see you in my next video. Thank you.